Good evening, everyone. I'm Tony Segreto, and once again, I'm honored to be your host and moderator for our In the Know virtual town hall. These town halls are an opportunity for all of us to share with you how UHealth, the University of Miami Health System, and the Miller School of Medicine are responding to the COVID-19 pandemic. As the only academic medical center in South Florida, we're excited to share our expertise in research and patient care with all of you this evening. As you know, COVID-19 is the first pandemic many of us have ever dealt with in our lifetime, but they're certainly not a new phenomenon. In fact, we know the first reported pandemic was recorded during the times of ancient Greece, and there have been many others since then. So here's the big question. What have researchers learned about these tumultuous and deadly outbreaks over the years? What do we know about how pandemics come to an end? And how can we apply that knowledge to what lies ahead for all of us, particularly as we move deeper into the reopening of society following the outbreak of COVID-19? We are so very blessed and extremely fortunate to have one of the world's foremost experts on the history of pandemics with us tonight. Our own University of Miami president and interim CEO of UHealth, Dr. Julio Frank, who has written extensively on this topic. He was Mexico's Minister of Health for 6 years and is a global health expert. He will lead our question and answer session tonight, along with several other UHealth panelists who will discuss how our health system is uniquely prepared to find solutions to deal with the pandemic crisis. Now, before we get started, let's go over how you can participate in tonight's conversation. Once our experts finish their address, they will answer questions that you've been submitting over the past few days. But you will also have the opportunity to submit questions during the program this evening. Here's how you do it. Right down on the bottom of your screen, there's a Q&A feature. With that feature, you can send us your questions. They are submitted anonymously, so you know that, and we will get to as many of them as we can. And those that we don't get to tonight, we will answer those in a written Q&A that we will post online. Now, we'll also send you an email with that link in the coming days. Well, now it is my honor and my pleasure to introduce to you Dr. Julio Frank, University of Miami president and the interim CEO of UHealth. Dr. Frank, as always, it's an honor to have you with us tonight, sir.
Thank you very much, Tony. It's truly a pleasure to join you again for this important conversation. On behalf of the entire University of Miami community, I want to express our deepest appreciation to all our health professionals, our support staff, who are literally on the front lines of our response to this unprecedented emergency. As an academic health system, and actually the only academic health system in South Florida, our most sacred duty is to save lives. First and foremost, by preserving the health and safety of our own staff, who will then be equipped to make a difference in the lives of our patients and our community. While our efforts to date have been really exceptional and our communities are slowly reopening, history has taught us that this pandemic is far from over and that the worst thing we can do is to lower our guard. COVID-19 remains a substantial threat and uncertainty still looms large, even though we're learning more and more about this virus as the pandemic evolves. This pandemic is so significant that for years to come, it will be a point of reference. There will be the way things were before coronavirus and the way things are after. It has had a dramatic impact on every facet of our lives, not just in our area, but our region and all over the globe. Now, I have had substantial experience. This is the fourth pandemic that I have been in some position of decision making. And I have to tell you that this one is unprecedented. It's in a category of its own, both because of the depth and breadth of its impact, both on health and now the economic consequences that follow the need to respond to this enormous challenge. As a public health professional, as a university president and a CEO on an interim basis of an urban health system, I cannot overstate the importance of guarding against subsequent waves of the coronavirus. Pandemics of the past have shown us the dangers of second and later waves, and they're really influencing the way we are planning our response in the immediate and midterm future here at the University of Miami. Tonight, we are going to discuss how we are incorporating this understanding as healthcare providers and as innovators. We are drawing on a gamut of research innovations and treatment protocols from historical outbreaks to understand and ultimately to conquer COVID-19. Our scientists at are hard at work developing diagnostics, drugs, and vaccines that will allow the world to overcome this pandemic. And I have no doubt that we will do that. And also, we will be better prepared for the next pandemic because this will not be the last one. If there is one thing I have learned in my experience as a physician, researcher, and an academic, it is that a critical part of how we keep people safe during any emergency is through clear, credible, consistent, two-way communication. Virtual town halls like this one are vital conduits for keeping the channels of communication open. As we navigate these uncharted waters, I encourage you to express your concerns, to raise your ideas, and to ask questions. Back to you, Tony.
Dr. Frank, thank you so much. Before we continue, I want to remind everyone that you can submit questions tonight, and that's again through our Q&A feature. You can find that at the bottom of your screen, and we will get to them shortly. Let's switch now from a historical perspective of pandemics to why UHealth and the Miller School of Medicine is uniquely qualified to find solutions to this global health threat. I'm pleased to introduce the Dean and Chief Academic Officer for the Leonard Millard School of Medicine, Dr. Henri Ford. Dr. Ford, nice to see you again, sir, as well.
I'm truly delighted to join you this evening on behalf of all the faculty, staff, students, and residents at the Miller School of Medicine. Our overarching priority remains the health and safety of our patients, our employees, and the entire South Florida community. Our researchers have been working diligently to develop rapid diagnostic tests, as well as novel therapeutic interventions to combat this formidable virus. Fortunately, our investigators at the Miller School have unique expertise both in elucidating and in defining how infectious diseases like COVID-19 actually spread. For instance, during the HIV epidemic in the 1980s, Miller School faculty member Margaret Fischel, a renowned infectious disease specialist, was one of the first researchers to actually develop antiretroviral treatments that ultimately changed the course of HIV to become what we know now as a truly treatable disease. Miller School researchers also played a pivotal role during the Zika outbreak back in 2017. That's because we're among the first to discover ways to slow down the spread of the virus. South Florida's diversity also offers a great advantage to us. It gives us the ability to understand and to manage population health. Because we have so many diverse communities, with residents coming from all parts of the world, especially from the Caribbean and Latin America, we have extensive expertise or experience in studying and in understanding health disparities. As a result, we have launched effective community-based health programs in South Florida in order to address some of the underlying reasons why certain medically underserved communities experience a disproportionately higher incidence as well as mortality from cancer and a number of other diseases. We also train our medical students to become transformational leaders who not only understand the importance of the social determinants of health, but also are prepared to address them through meaningful public health interventions and expanded research and treatment programs that are focused on areas such as substance abuse, diabetes, obesity, heart disease, and other illnesses that tend to be more prevalent in these disenfranchised communities. Now, our work on the global pandemic is also going on very strong. For instance, Dr. Sylvia Donald, who is the chair of the Department of Biochemistry, is currently awaiting FDA approval for a point-of-care diagnostic test that will give results in fewer than 30 minutes. And Dr. Mario Stevenson, who is the chief of infectious disease, is also working on a similar diagnostic test, but for research purposes. Then we have Dr. Natasha Sturbo, who is in the Department of Microbiology and Immunology, who is working on a vaccine therapy based on a platform that has previously used to treat cancer patients. And that's also showing great promise. We have Drs. Hare and Dr. Ricordi, who are conducting clinical trials using mesenchymal stem cell infusion to reduce the exuberant inflammatory response that we typically see in the latter stages of COVID-19 infection when these patients are in severe respiratory distress. Dr. J in the Department of Medicine is working on a trial using a monoclonal antibody to treat acute respiratory distress. And he and another colleague, Dr. Colbert, are also proposing clinical trials in conjunction with the National Institutes of Health, looking at hyperimmunoglobulin or convalescent plasma from people who have already recovered from COVID-19 infection as a way to treat those who are now severely infected with the disease. And of course, we have Dr. Erin Kobetz, who will be speaking to you shortly. And she and her team were the first to partner with Miami-Dade County to conduct detailed surveillance studies for COVID-19 throughout the county in order to better evaluate community spread. So my friends, as you can see, this is just a small sample of the amazing work that is going on at the Miller School. Clearly, the Miller School is at the forefront of the vigorous effort to find answers to combat this virus. And I'm certain that when we emerge from this challenging period, we'll be far better prepared and united to seize the opportunities that lay ahead for the Miller School as well as UHealth. So thank you, and I look forward to your questions in a bit. Now back to you, Tony.
Thank you, Dr. Ford. Now let's turn our attention to questions submitted by some of you. Joining us are UHealth experts, Dr. Erin Kobetz. She's the Co-Vice Provost for Research, Associate Director for Population Science and Cancer Disparity at Sylvester Comprehensive Cancer Center. And Dr. Hermes Flores, who is the Interim Chair of the Department of Public Health Sciences, Director of Epidemiology and Population Health at the Miller School, and Director of Geriatric Research Education and Clinical Center at Miami Veterans Affairs Healthcare System. Dr. Flores is also an alumnus who graduated with his master's degree in public health from the University of Miami back in 1988 and his PhD in epidemiology in 2006. Welcome to all of you. Now let's get to our first question, which is for President Frank. And President Frank, you sort of touched on this in your opening statements. Given your expertise in public health, specifically in dealing with pandemics, can you talk further about how pandemics behave traditionally and why you are so concerned about this second wave we keep hearing about?
Sure. Every pandemic is different, but the one commonality we have is that by definition, the emergence is characterized by uncertainty. Pandemics emerge when there's a new pathogen, a novel virus in this case, which is a strain of the coronavirus. And because this is the first time that we humans encounter that particular virus, we don't know exactly what's going to happen. There are lessons we learned from the past and we can infer some of the patterns, but we cannot be absolutely certain. So we need to be prepared with very clear contingency plans. We need to create all the different scenarios and be very open to learning as the pandemic evolves. And that's exactly what we've been doing. Now, there are different types of pandemics, but this one in particular, the typical story is these are typically zoonoses, meaning these are diseases that are found in animals. And because of the way we interact with nature and the very unsustainable practices that we have for, building our food supply, and particularly a common practice in many Asian countries and other parts of the world of having very crowded markets where you have this cohabitation of live animals and humans in very close proximity, those viruses, which are present in animals, will jump the species barrier and appear to humans. That's first step. The second step is when there's human-to-human transmission and sustained transmission. And if that is typically happens in respiratory diseases, because they are very easy to transmit from one person to another. When you have person-to-person transmission, if it is a respiratory virus, of the characteristics of this coronavirus, you can almost be certain that there will be a pandemic, that it will spread very rapidly. And that's exactly what happened here. It followed those patterns. Now, this particular virus is highly contagious. It's more contagious than the influenza virus, which is a similarly transmitted disease, but this is more contagious. The second characteristic it has is that it can be transmitted by people who are asymptomatic or who had very mild symptoms. In this, it's very different, for example, from SARS, which is caused by a different coronavirus. In SARS, only people who are really sick can transmit it. By then, they're already in the hospital, they're isolated. Here, you can have people who look and feel fine, circulating among us, and unknowingly transmitting the virus. And that's what's made the whole response so very complicated. Now, it's forced every country, including the United States, to move to these massive lockdowns, because exactly since you lose the ability to track every individual case, once you have an established pattern of what's called community transmission, you need to ask everyone to stay at home to reduce the transmission. Whether you are sick or not sick, you are asked to stay at home. And that's what's happened. And it's been a huge sacrifice. Jobs have been lost. People have been locked down. It is very important now that as we resume our a process of reopening the economy, we do that cautiously and in phases, so that precisely because of those attributes of the virus, we don't trigger a second wave of the disease, which could force us to lock down again, and then would set us back despite all the sacrifices we have done so far. So one thing we have learned is that letting our guard down. This is what happened about a century ago with influenza. You know, it had a first wave. It sort of started dwindling during the summer months, and then it came back with a vengeance in October, in the fall of October of 2018 and the winter of 2019, and that's when it actually caused more deaths. Now, we're not in 1918, okay? A century later, we have a big difference, which is our scientific tools. We have science on our side today to an extent that was unimaginable a century ago. So we don't need to repeat that pattern. We have much better tools through testing to identify those patterns and follow. We have better tools through drugs, which are being, again, subject to clinical trials all over, and UHealth is participating. And eventually we will get a vaccine and we will defeat this coronavirus. But in the meantime, it is our behavior, the way we go back in this gradual reopening of the economy, that's going to make the difference. And that's why we need to do that cautiously, following instructions, observing social distancing, protecting our personal spaces by the use of face masks and all the other recommendations that everyone knows.
Information, again, just great information, Dr. Frank. I could listen to you all night talk about this because you're just so fascinating and so informative. Dr. Kovitz, your SPARK program was the first in the nation to help track the community spread of COVID-19 in partnership with a local county. How is this program affecting Miami-Dade's response, and how is it influencing decisions to reopen our society?
Thanks, Tony. So the work we're doing is another source of information that the Miami-Dade County Mayor, Carlos Jimenez, and his team use to inform their operational decisions in real time about what to do to protect the public health and well-being of our local community. President Frank and I actually had this conversation a week or two ago, and he said, okay, well, what do you think about the reopening? And he said, based on the data. And I said, what's very interesting is I've been asked to lead the data collection effort. And so as the head epidemiologist working with the mayor, I believe it's really important to maintain my objectivity in data collection and not to be stopping and evaluating the data and then also making real-time decisions about how to act on it. Because once I do that, I think that I start to compromise my objectivity, which is the hallmark of any good science. And other people may see what I'm doing as being politically motivated. And it's really, really, really important as a scientist for me to stay above that. So we share our data with the mayor and his team. We believe that they use the information to critically apprise the decisions that they're making. I know that it was very important for him that we got back into the field this week, now that things have started to reopen over the past 2 weeks, so we could really assess whether there's been any impact on the reopening on the prevalence of infection. And we continue to share the data as transparently as we can and allow other people to make decisions about how to use that data to inform public policy and practice around public health well-being.
Dr. Kovitz, thank you. President Frank, back to you. What are some of the factors, historically speaking now, that lead to a pandemic? Are they more prevalent now? I know you touched on that a little bit with your last answer, but I wanted to ask in a different way what those factors are, and are they more prevalent now?
Well, it's very interesting as we wait for Dr. Flores to come back. But it's very interesting, and you said it a little bit, Tony, at the beginning. Pandemics are not a new phenomenon per se. In fact, the first documented case of a transnational epidemic, because pandemics by definition need to cross borders and affect most of the globe. The first documented case is what was called the Athenian plague, and that happened in 430 BC. And it was directly linked to trade in the ancient world. It actually brought classical Greece basically to an end, brought it to its knees. Then, we're all familiar about the episodes of the Black Death in the 14th century, which killed about a third of the European population. It was also linked to international trade. And then, just here in our continent, obviously the Spanish conquest of the Americas defeated the mighty Aztec and Inca empires. And that was basically through the introduction of smallpox. This was one of the earliest cases of involuntary microbiological warfare. And more recently, we have the great influenza pandemic of 1918, 1919 that I was talking about. So this is not new. What is new is the intensity of our interaction with each other through the forces of interconnection, the widespread presence of international travel, the prevalence of global trade. All of those forces really have brought these elements to a different level of intensity. But the other factor, because that globalization brings a lot of benefits in terms of prosperity, of economic growth, it connects us as human beings. The answer is not to cut that globalization. The answer is, how do we relate to our planet? A lot of the recent increase in the frequency of pandemics do arise from what I was saying before, unsustainable ways of relating to other species in our planet. The way we invade ecosystems, for example, by destroying ecosystems in order to make room for urbanization or for agricultural development. And that puts humans in touch with some of those animal species that may harbor viruses that are not naturally found among humans. Similarly, our practices, for example, with poultry, with swine production, pork production, in very, very crowded conditions, unsanitary conditions, sometimes inhumane conditions. And this market practices of very close coexistence between humans and live animals, in the so-called wet markets. All of those forms, unsustainable forms of food production and of interaction with other species, is what's leading to the growing frequency of this so-called zoonosis, jumping the species barrier and affecting humans and leaving us all very vulnerable. So I do think we need to understand that this is not just a natural event, it's largely created by those ways in which we relate to nature. And one of the lessons that we need to derive from this very painful experience is that we need to find more sustainable ways of relating with the rest of our planet.
Dr. Frank, thank you. We have reconnected with Dr. Flores. Dr. Flores, it's great to have you with us. So here's my question. I'm not quite certain you heard this before. The Department of Public Health Sciences, which you chair, has had a strong response to the pandemic. Can you talk a little bit about how we're tracking the population response to social distancing and mobility?
Absolutely. Thank you, Tony. And sorry about the prior technical difficulty. Within the aspirations that President Frank has envisioned for the University of Miami, is the opportunity to collaborate with countries such as Mexico, and the Department of Public Health Science faculty, the staff, and together with the Mexican government had put together a tool that precisely helps us prepare to provide a response tracking how successfully or not has been the containment, the mitigation strategies at the state level, which is the uniqueness of this effort led by Felicia Knoll. Dr. Knoll is a member also of the Department of Public Health Science, and together with Dr. Ramon Veliz and Leila Bosova, has put together information built on the experience that had come from the Oxford COVID government response tracker. And this instrument has allowed to precisely assess the measures that President Frank and others had alluded before, closing schools or worksite activities, canceling public events, suspending public transportation, restricting traveling within the states and internationally. And the idea is that this will help not only evaluate the extent of social distancing, but also the timeliness of the adoption at each state, and also the response of the population in terms of reduced mobility. The aspiration from this unique team that is providing information in real time is that this effort will build to other countries such as Brazil, where the numbers are significantly increasing, as we have heard recently in the news, and also includes other domains beyond the traditional mortality data and cases, assessing access to the health services, and also domestic violence and the impact also on the economic downturn. So I think these are examples clearly on how the University of Miami is putting into practice lessons learned within the department, involving our own alumni and also involving faculty addressing the emerging challenges.
Dr. Flores, thank you. Dr. Ford, what have we learned from past pandemics that's impacting our current research?
Well, I think if you've heard President Frank touch on it already. What we have been able to do is, for instance, when it comes to our experience during the Zika outbreak just recently, we were among really the first to come up with strategies to slow down the spread of the virus. So it gave us a head start when COVID-19 came into play, because the same platforms that currently exist, we've been able to pretty much reactivate in our attempt to not only come up with a more rapid diagnostic test, but also to look at possible vaccine therapy. So we continue to build on all of the past experiences. And as I noted before, Margaret Fisher was one of the first people to introduce antiretroviral treatment for the treatment of HIV. And so this history. So we have a long history of practical interventions and applications in our Department of Microbiology and Immunology, as well as other departments such as biochemistry.
Dr. Ford, while I have you here, I'm going to keep you here because we just had this sent in. The question is, how reliable are the antibody tests and what significance do they play in the safeguards for reopening?
There's been quite a bit of research and numerous reports on the fact that the antibody tests don't really tell us the whole story. They just don't tell whether or not the patient is truly immunized against the development of the virus. And we've heard of individuals who may have had the virus, who've had the antibody, but yet have gone on to become reinfected. So the reliability right now is really not clear. And there is a parallel that we have to draw on as far as HIV is concerned, because as you know, you may have antibodies, but that does not confer immunity. So I think this SARS-CoV-2 virus is beginning to behave somewhat like that, although it may still be too early for us to tell, because we have to really test a battery of different antibodies before we can conclude that they really offer no protection. We are anxious to see what develops over the course of the summer, and you know, there are multiple proteins that are potential targets for antibody development, and we will have to systematically evaluate which ones are actually going to be crucial for conferring immunity to the person who has contacted the virus.
Dr. Ford, thank you. Dr. Kobitz, what are we learning about the disparities leading to underlying conditions that make people of color more likely to die from the coronavirus?
So one of the silver linings for me about the coronavirus is the fact that health disparities among racial ethnic minorities is being forced to the forefront of our national dialogue. I'm certain that Hermes and President Frank and Dean Ford agree with me that health disparities are not unique to COVID. They exist and persist for most chronic conditions. And in my mind, if the COVID epidemic brings them to the forefront of opportunity for us to start asking the hard question of why and what to do about it, I'm extraordinarily grateful. So I think the issue of why minorities are at increased risk of dying of COVID is a complicated one that is likely multi-level in orientation. I think it reflects social determinants that preclude unequal access to care, particularly primary care for individuals who may be experiencing symptoms and don't have anyone to check in with to assess whether or not those symptoms require necessary medical intervention. We know that there is an excess prevalence of comorbid conditions among many minority groups that predisposes them to more severe symptomology and worse outcomes from COVID. And then I think that there is a lot of misinformation and variability in the information about COVID and its etiology and whether or not it's survivable across diverse populations that we haven't really done a very good job of attenuating. And so when we identify hotspots in Miami-Dade County through our surveillance efforts, we believe that it's really important to not just approach trying to attenuate the disparity from our vantage point or expertise, really to engage key community stakeholders from those particular neighborhoods to help us understand what they believe may be driving the disparity, so collectively we can determine how to apply our evidence-based practice to their reality. We find through this campus community partnership, we can really drive effective change in other disparities that have persisted and continue to persist before and even after COVID.
Dr. Kobitz, thank you. Dr. Flores, How can we help young adults who are dealing with the psychosocial impacts of COVID-19, such as loneliness, anxiety, and depression?
Thank you, Tony, for your question. So actually, one issue that was not initially addressed in the COVID-19 outbreaks was that it was not only the older population and those with those comorbid conditions, but also the younger folks that can be also at higher risk, especially those that are vulnerable because they have substance abuse, they are HIV positive. And part of the efforts that we're trying to understand is the degree of loneliness and isolation may play a role in increasing poor outcomes and poor adherence to therapy. So faculty within the department, Dr. Viviana Horrigan, and a recently graduated MPH from our program, Renee Smith, have been working, building on prior work to identify the association between this degree of loneliness and isolation, and then propose strategies to confront those, building beyond just the drug abuse and anxiety and depression, and see what the implications of social distancing and these ongoing loneliness related to the mitigation, the containment associated with COVID-19. So these, hopefully this perspective will provide a strategy, be the foundation for strategies on how to address that, whether with the use of technology, such as mobile devices or others strategies.
Dr. Flores, thank you. Dr. Frank, we just had this sent in talking about students. Will UM follow the lead of many schools to end the semester at Thanksgiving till the new year?
Yes, let me tell you that I am personally in contact with my colleagues, regular contact with other presidents. I know the provost does the same thing with the provost. I know that our fantastic vice president for student affairs, Dr. Patricia Whiteley, does exactly the same. We are in communication, trying to see what ideas come, how are they relevant. One idea that we're definitely considering now is the possibility of sending, it is our goal to open on time and in person for the fall semester, to have the students back on campus for the fall semester. Obviously, provided we can do so safely. Our number one priority will always be the safety and health of our students, faculty, and staff. And we're working very hard to meet the conditions so we can do that safely. So one of the scenarios is we will start classes, and then we would basically release students for Thanksgiving, finish whatever classes are left online, and also administer the final exams online. And that would allow us not to have students fly back home, then come back. Some of them maybe from places where they might be a more active epidemic than here in Florida, and then have to quarantine, etc. So that idea, which many universities are adopting, is something we're right now considering. We're consulting with the faculty. We're looking at all the practical implications, but it would make sense because, first of all, students who travel back home for Thanksgiving, then come back for only 3 weeks, and then go back again for the end of the year holidays, would, first of all, save money. They would only have to travel once. But secondly, they would be kept safe by not returning. Now, all of that is part of our contingency planning. We are expecting, like most experts in my professional community of global public health, we are expecting that there will be a second wave. What we don't know is when exactly will it hit, how bad will it be? That, as I was saying before, will depend on the way we reopen now. But we have created 3 scenarios about different timings of that second wave. And if the timing happened towards the end of the fall semester, really towards the end, this sort of modified calendar would make a lot of sense. So the answer is yes, it's a very good question. You know, it's been in the media, and we're definitely looking at how to not adopt, but adapt it. Not adopt it, but adapt it to the particular circumstances at UM It is one distinct possibility. It's a decision we'll be making very soon, because obviously we need to notify the students and parents so that they can plan accordingly.
President Frank, thank you as always. Dr. Ford, we've been hearing a lot about the multi-system inflammatory syndrome associated with COVID-19 that's now affecting children. Is there a way to protect my children from it?
Oh, this is a great question, Tony. Unfortunately, right now, we are all learning about the development of a brand new disease. And what we clearly can say is that these children have been exposed to the virus at some point. The question is whether this is a post-recovery situation, or is it still part of an active process? There are still many unknowns. It behaves very much like this Kawasaki disease that we know so much about. It seems to attack a number of different organs, including the heart, and not just the lungs, as is typically seen in COVID-19. So we are still learning a whole lot about it. And I know everyone says, well, children are really immune to the disease. They don't really show signs and so forth. But I think what's evolving right now is evidence that perhaps they are not necessarily as immune as we think they are. And so the same precautions that we take as adults, we should also make sure we take them for our children. One of the really difficult cases that I know of involved a child whose mother had the disease, and then ended up really with severe multi-system inflammatory syndrome, so multi-organ inflammatory syndrome.
Dr. Ford, thank you. President Frank, we just had this sent in. And the question goes like this: while I believe that we are one human family, is COVID-19 highlighting the risks of globalization? Would it be better for individual countries to aim for self-sustainable economies?
I think it would be tragic if the conclusion of this is that we need to isolate ourselves. It's not whether we remain connected to the rest of the world, it's how we do that. It's not whether we do trade with other countries. That's unavoidable, and it's been a big part of building a prosperous world. It's how we trade. It is not, whether we want to stop traveling and exploring other regions of the world. It's how we do that. Furthermore, technologies like the one we're using today have now inherently connected all of us. It is just not part of the human character and the human experience to think that we can isolate ourselves. So one of the lessons is that actually global problems, global challenges like this one require global solutions. No country, it would be an illusion to think that if we isolate ourselves, we can buy ourselves, even the wealthiest and most powerful country in the world, like the United States, cannot buy itself from all the forces that affect our planet. We're talking, things like climate change. No country can buy itself, deal with that, because that depends on what the rest of the countries do. Same thing with pandemics. There's just no way to isolate ourselves, and it's not desirable. We are still in the longest period of prosperity and peace in human history. It's the world order that came out of World War II. And it was predicated on the idea of global engagement. But through institutions in the multilateral system, this year is the 75th anniversary of the founding of the United Nations. And while those institutions like the World Health Organization, the United Nations, certainly can improve and require major reforms, it is not by shutting ourselves off from the rest of the world, which, by the way, is impossible and would bring very negative consequences, that we're going to achieve that. I think the reflection is not whether we engage, but how do we engage? And I do hear voices saying, you know, if we could only block ourselves off from the rest of the world. But think about this virus. Or think about the last pandemic. The last pandemic was the H1N1 swine flu, 2009. The first cases happened in Texas, in the United States, and in Mexico. Fortunately, they were detected earlier because both the US and Mexico have very good epidemiologic surveillance systems, and the alarm went off to the world, and the world was able to respond. This is what we need to build. It's a much more of a sense of shared responsibility for our common planet. This is our common home. We can't just block off our little corner of the home and pretend that what happens elsewhere is not going to affect us. Global challenges require global solutions, and science is the key. As we're speaking, the reason I'm very optimistic about the fact that we will have a vaccine in about a year's time is because one of the bright things that this pandemic has brought is the most intense level of cooperation among scientists all over the world. These are scientists in universities, in government, in industry. Everyone working together around the world. And those scientists are not, you know, blocking themselves off and trying to not cooperate with others. We know that one of the promising vaccines is over at Oxford University, which is not here. Others are in other countries. There are many here. The University of Miami is part of that effort. Global challenges require global solutions. And I think that is one of the big lessons from this pandemic.
President Frank, thank you. Dr. Kobitz, another one just sent in to us. The Florida Department of Health death rate for COVID-19 is dropping dramatically. How do you interpret this?
So that's a great question. And from a public health perspective, I think that the dropping death rates is very, very promising. Part of it may reflect also a lower incidence of infection because social distancing or physical distancing measures were effective in reducing the transmissibility of infection. And I also would like to give a shout out to my healthcare colleagues on the front line who've really developed effective clinical algorithms to preclude people from getting to the place where there isn't the possibility of true efficacious medical intervention. And so I think one of the other really bright spots of this whole COVID pandemic is that it's forcing us to think on our toes, outside of the box, and to move very rapidly to develop strategies and solutions that can have clinical efficacy and public health impact. And so I think that's part of why we're seeing a reduced death rate from COVID, is that when people come to the hospital, we're better able to offer them solutions that keep them from getting to the point of intubation when the possibility for recovery is pretty low.
Thank you, Dr. Kobitz. Dr. Ford, another question just sent to us, and here it goes. How effective as a safeguard now is the taking of an individual's temperature before that person enters a building, given that people may be asymptomatic and have COVID-19?
An excellent point. What we're trying to do in as much as possible is to be proactive. Certainly, if you have symptoms, then it suggests that if they happen to be related to COVID-19 infection, you are experiencing a higher rate of virus shedding. So that is an important consideration. But it is also true that you may have the virus, you may be shedding some virus and not have clinical manifestation of the disease. So we have to really consider the totality of the picture. But certainly the presence of fever or a temperature should heighten the suspicion for further investigation. Whereas a regular person walking through who has no sign, then you may be less inclined to actually subject that person to testing. But if we had the capacity to test everybody, then we could actually do it less in a less discriminating fashion. But for now, we need to have some parameters to initiate the testing process. And having fever or cough and other symptoms that may be suggestive of an infectious etiology should heighten our suspicion that something could be happening and therefore lead to testing.
Dr. Ford, thank you. Dr. Flores, wearing a mask can make communication difficult, especially for those who are hard of hearing. Are there strategies to help that?
Thanks, Tony, for your question. And actually, yes, the social isolation that is being imposed as a strategy to respond to COVID-19 has posed an additional challenge for those vulnerable, like those with hearing losses. And members of the department, such as Dr. David Lee, working with colleagues in other academic institutions, have proposed strategies to actually overcome some of the limitations associated with the use of the face mask or surgical mask. And one of them is when speaking, do it face to face and speak slowly. Try to talk back to check if the message has been understood. There are even opportunities for those that have hearing impairment through the use of telehealth or other measures or communications to have instant captioning. So those are measures that potentially can help overcome this challenge for those with hearing losses and other type of visual impairment, other type of impairment such as visual as well.
Dr. Flores, stay here. We have a question that was just sent to us. Is it safer for seniors now living in a single family house to stay there rather than move to an apartment as they get older?
Well, certainly those older adults that are living by themselves are at a higher risk for mental health conditions. So if they are living by themselves, there is a need to provide some measures to overcome the isolation. And one issue, and this is related to a previous comment by Dr. Kovacs, is that there is a need to reduce the exposure to those that are more vulnerable. Precisely that is a measure that has been somehow effective in the state of Florida. So I would say that it is safer to keep them there as long as there's a way to provide some way of communication, some way of engagement. Now with the use of technology, there are opportunities to engage even the younger generation. Maybe our students or teenagers that are pretty technically savvy can serve as a sort of advocates, ambassadors to facilitate for some older adults. Maybe the grandchildren can do that with the appropriate protection. So it's a way to build back this kind of bridge and reduce the social isolation, which is particularly affecting those vulnerable individuals.
Dr. Flores, thank you. President Frank, since summer is here and people are now thinking about going on a vacation, someone just sent this in and said, how safe is it being on an airplane? And what kind of pre-boarding testing may help minimize the risk of transmission?
Yeah, you know, I'm also looking at the Q&A, and there's a very good point by one of the persons who are joining us about, you know, should we be so fearful that we can't do anything? We might as well just stay locked in our homes until we have a vaccine. That is not, I completely agree with the comment. The idea here is not to be fearful, but to be cautious and to follow the recommendations. We need to get back to a level of activity. There's been this false dilemma of whether to promote economic recovery or public health goals. The two are mutually reinforcing. We can't leave people locked up all the time because that hurts the economy, and that itself has a negative effect on health, plus all the isolation issues that Dr. Flores has been talking about. On the other hand, we don't want to reopen in an irresponsible way that would then lead to new infections, potentially to a return to a lockdown that would actually set the economy backwards and would hurt the economy. So we need to think of both at the same time. In answer to this question, it is of course, if we follow the protocols, and I've been reading what the airlines are doing, it should be safe to do so. But check with airlines, make sure they're following some of the hand hygiene, the surface hygiene, the purification of the air, the turnover of the air, the requirement that every passenger wear a mask. Remember, the face masks do protect you, but they also protect everyone else. So what we need is a system of mutual protection. It's a mutuality of trust in each other. I will protect you, you will protect me by all wearing a mask. Making sure we maintain hand hygiene and thorough cleaning of surfaces. And then keeping the social distancing. That's very difficult in a plane. That's why you need to do all the other things. Plus the sort of screening that Dr. Ford was talking about. You will be screened before you can board the plane to see if you have fever, or you will be asked and screened for other symptoms. And if you do have those, you won't be allowed to board the plane. You will be sent for further exploration, and then you can fly later on. So there's the airline industry is being very innovative. Many industries are their survival is at stake here. And they are being very inventive, and they do know that the safety of the passengers, and they trust they can transmit, is essential for a recovery of the industry. So I think keeping an eye on that, making sure that when you select a flight, that it is adhering to these protocols, I think that is the way to proceed with travel plans for the summer.
Well put, Dr. Frank. Mutual respect, mutual protection, one human family. Dr. Ford, do you have any updates on potential treatments for COVID-19 like convalescent plasma?
So this is still an experimental treatment. And we've heard numerous anecdotal reports that some people have recovered after receiving treatment with convalescent plasma. But we don't have any large-scale studies quite yet. But we know this is a form of a therapy that goes back many decades and proved to be useful, really at the turn of the last century. So we are hopeful that the data, the clinical trials that are currently ongoing, will demonstrate that it does make sense. But the principle is that the plasma from people who have recovered probably has a plethora of antibodies, some of which must be active potentially against the virus. And part of the challenge is to determine which one of the many antibodies that are probably present in the plasma could confer meaningful immunity to the patient. So here is kind of a potpourri of options, and you just essentially throw the kitchen sink in terms of plasma at the patient, and in many instances, the response has been very good. The only problem is just that it's an imprecise way of managing the disease, and it doesn't bring us closer to identifying a vaccine per se, or an antibody, or a specific antibody that could be expended for further treatment. But yes, it does show some promise, but we need to have much more data, much larger clinical trials, which is why our own investigators are currently collaborating with the NIH to conduct such a study.
Dr. Ford, thank you. And President Frank, we're going to end on this question and then some final comments from you. What will be our major lessons of COVID-19?
There are many lessons, but I think I would say and I've kind of mentioned that there are three big lessons. First, we need to change the way we relate to the planet. We need to make it sustainable. We need to be more respectful of ecosystems, because we ourselves get exposed when we invade those ecosystems in an unsustainable way. That's the first one. This is a big call for protecting our planet. This is our common home. and we are part of that. Second big lesson is what I said a minute ago. Global challenges require global solutions. There's no comfort in the idea that we can isolate. It's not realistic, and it probably would be totally counterproductive. Especially a country like the United States, which leads the world in so many aspects. It has played such a key role in the global prosperity, this period of unprecedented peace and prosperity. We need to continue to build on that, while making the necessary safeguards of making that engagement sustainable and appropriate. And the third one is that the ultimate solution lies in science. It is the investment in science. One of the things that frustrates those of us who work in global public health is that every time there's an outbreak, a pandemic, there's all this flurry of attention, resources are invested. And then as soon as the emergency passes, and this will pass, then we go back to the old normal. We forget about it, we are not prepared. I hope that the depth and extent of this pandemic will make everyone realize that this thing is not over once we have the last case. At that point, we need to be ready for the next pandemic. And we need to continue to invest, and we need to understand that health security is part of national and global security. We need to have ready those platforms for tests, for drugs, and for vaccines, so that, because we cannot predict what is the next pathogen, we quickly and immediately have the platforms ready, so we can sequence the genome of the new virus that will emerge in the future and quickly apply it to those platforms. And we have the tests that we were so late in deploying this time ready from day one. We have the drugs that will help treat those who fall ill, and we have the vaccines that is the ultimate solution to these problems. We need to invest in better surveillance systems. We need to invest in rules of the game that make it clear that countries need to report early. A lot of time was lost in the initial reporting of the global emergency. We need to correct that. But that means that we remain vigilant and prepared. You don't, start building your fire squad when you have the fire outbreak. You have that capacity ready. When there's no fire, that's the time to build that capacity. And that's what we need to do now. And it has to be science, based on science, and it has to make us ready to respond immediately to the next pandemic, because there will be others. It's part of the way we interact with each other and with the natural world. Hopefully, we will do that so much better in the future that the frequency of those pandemics will be spread out. But we need to be ready in the interpandemic period with the solutions that we can deploy immediately when the next outbreak occurs.
Dr. Frank, thank you so much. And thank all of you for participating in tonight's In the Know Town Hall. A full recording of this program will be posted online, and you can look for that link in your email. What an incredible and informative hour this has been. And once again, as supporters, and for some of you alums of our great university, this should make you, I know it makes me, so proud to be a part of this amazing group of talented, inspiring, and passionate professionals. Again, you will see this recording online. We will send you an email with that link in just a few days. And if you would like to support UHealth's response to COVID-19, you can visit uhealthemergencyrelief.com. Once again, from all of us at the University of Miami, we wish you and your family good health, stay safe, and remember, it's all about the you. Good night, everyone.